Today, after almost a century of trying, today, after over a year of debate, today, after all the votes have been tallied, health insurance reform becomes law in the United States of America.
That was President Obama 1 year ago today, and back then Democrats, including Nancy Pelosi, were claiming the new law would create hundreds of thousands of jobs. Some said millions of jobs. But now there is a report from the left-leaning group, the Urban Institute, saying the overhaul will have no noticeable effect on jobs. Others suggest we'll lose jobs because of it. What does the Ohio Senator Rob Portman, the Republican on the Senate Budget Committee, think about this? Senator, good morning to you and welcome back to America's Newsroom. What do you think we've learned about this bill in 12 months?
Well, Bill, unfortunately, I think that report understates the impact of this legislation, which is it's hurting jobs, not helping jobs. And it's already happening. And it's happening for a few reasons. One is it increased the cost of health care. So small businesses all over this country are saying we can't afford to bring on somebody because of the costs of health care that are going up, not down, because of this legislation.
Well,
I've spoken to businesses all over Ohio about this bill, and they tell me, look, we're going to pay overtime, we're going to bring people on part-time, we're not going to bring on full-time employees, even though we have more orders, more business because of the costs of health care.
So it's the cost they're concerned about, or it's the lack of direction about the future of the bill, which is
I think there are three things. There are three things, and they all relate to cost. First is just the fundamental cost increase. Even the administration has said there's going to be an increase in costs. It's about 3 times inflation this year and going forward with this legislation. Second, I think it's the individual mandate. As you know, there's a mandate on individuals but also on employers. The National Federation of Independent Businesses, which represents small businesses, says that will result in over 1.5 million jobs being lost. But that's related to cost, the mandating cost. And third is the confusion about the regulations. There are over 2,000 pages of regulations being worked through right now. And as you talk to employers, part of this is uncertainty about what the costs are going to be. They know they're going up, but they're not sure precisely what they'll be and what the mandates will be on them. So companies that have a good health care plan that they like, that their workers like, may or may not be able to keep that plan. So this cost, the mandate, and the confusion is resulting in job loss right now. We can't afford it. We have over 9% unemployment, and it's not something that we can afford in Ohio or around the country.
Yeah, I know, especially in Ohio with the drain that's happened in the Buckeye State. Has this entire bill, in your opinion, backfired?
Well, I think it's backfired in a couple of ways. One is in terms of the economy and growth, which should have been our #1 priority over the last couple of years. It's going to make it harder, not easier, for us to get out from under this downturn. The recovery has been very slow, and I believe a big part of it is because of the health care legislation. I was at a small business roundtable recently, Bill, and I've done them all over Ohio, as you know, the last couple of years. The #1 issue on everybody's mind of about a dozen small businesses was health care. So that's one way that it has backfired. It's not helped us to achieve what we're all trying to do, which is to get this economy moving again. Second, we find ourselves in a very difficult fiscal situation. You've talked a lot about it. We've got a record deficit. We have record debts building up. Many people are concerned about a debt crisis coming up. This health care legislation is affecting that, because you think about it, the biggest cost drivers in our budget right now, and the biggest part of the budget is health care, particularly Medicare and Medicaid. And health care costs is driving a lot of that. So the two fundamental issues that we have to deal with right now, getting the economy moving, bringing jobs back, and then dealing with our fiscal crisis, are making it more difficult. Thanks to the health care legislation that we passed.
Yeah, it is health care and jobs. They're issues 1 and 2 stacked up right against each other. Senator, thank you for coming back today, 12 months after it was signed into law. Rob Portman is a Republican out of Ohio.
Good to talk to you, Bill. Thank you.
Thank you, Senator.